The article I chose to review was entitled Comics as a Medium for Providing Information on Adult Immunizations. In this article, a study was done using a randomized trial to determine the effectiveness of two flyers on communicating health information about adult vaccinations. One group received a flyer created by the Centers for Disease Control and Prevention entitled, "Do You Know Which Adult Vaccinations You Need?" The second group received a flyer in the form of a comic with information adapted from the CDC flyer. With the growing popularity of comics, especially with the adult population, the researchers wanted to determine if the medium of comics could be used to present health information to adults. A previous study was done using comics as a medium to provide information on adult vaccinations. However, the population used in this group was pharmacy students. The researchers wanted to determine if the results from the previous study could be replicated in the general population. The study ran from December 2015 to January 2016 at a diagnostic and treatment center in St. Albans, Queens, New York. The persuasive hierarchy of effects model was used as the theoretical framework for this study. Both flyers used in the study listed the types of vaccinations that adults needed and suggested that adults speak with their doctors about vaccines. The CDC flyer on the left lists the types of vaccines, including influenza and Tdap, and it also uses photographs as the visuals on the flyer. In comparison, the comic flyer uses narration and drawn characters to depict the story of adults coming in and talking to their doctor about vaccines. The research problem is that adult immunizations reduce health consequences and prevent the spread of disease, but despite these benefits, U.S. adult vaccinations remain low. 50,000 to 70,000 adult deaths could be avoided through vaccinations. Also, providing easily understandable health information that encourages reading is an ongoing challenge in healthcare. To combat this, the researchers wanted to determine if comics could be used to present health information. The objectives of this study are to compare the effects of the CDC flyer to the comic form flyer on participants' attitudes towards the vaccine information, perceived informativeness of the vaccine information, intention to seek more information about adult immunizations after viewing the flyer, and intention to get immunized after viewing the flyer. The sample used in this study were 284 adults over the age of 18. Participants ranged in age from 18 to 65 and older. 265 questionnaires were used from the 285 adults who initially signed up to participate. 19 questionnaires were not included if they were incomplete. The CDC flyer group consisted of 132 adults, and the comic group consisted of 133 adults. The intervention was done by the researchers setting up a table in the waiting room of the medical center and approached adults as they entered the center. Adults who participated were randomly assigned to receive the CDC flyer or the comic flyer depending on the day of the week they enrolled. Participants received the flyer, a cover letter stating the purpose of the study, and a questionnaire for evaluation. In total, participants spent 10 minutes reviewing the flyer and completing the questionnaire. Evaluation was done using a questionnaire developed by the researchers using items from the Marketing Skills Handbook. 6 items from the handbook tested attitudes toward the flyer and perceived informativeness of the flyer. 3 items tested intention-related variables, such as intention to be vaccinated after looking at the flyer, and intention to talk to their doctor more about vaccines. A 7-point differential scale was used to measure each item. Analysis was performed using SPSS, and analysis of variance was a test that was performed. Also, an independent samples t-test was performed to compare the two groups, this group that received the CDC flyer and the group who received the comic flyer. The results of the study indicate that there was a statistically significant effect on participants' attitude toward the flyer. The group that received the comic flyer had higher attitude scores than the group that received the CDC flyer. There was also a statistically significant effect on participants' perceived informativeness of the vaccine information. The group who received the comic adaptation also had higher scores than the CDC group on this scale also. However, there was no statistically significant effect on participants' intention to seek more information about adult immunizations after viewing the flyer, and there was also no statistically significant effect on participants' intention to get immunized after looking at the flyer. The conclusions that the researchers found were that the flyer with the comics was evaluated as more attractive than the CDC flyer. However, this did not translate to influencing participants' intentions to change their behaviors. The study had several strengths, including design strengths and communication strengths. A design strength was the relatively large sample size of 265 participants participating in the study. They also used several age ranges and didn't focus on one. Participants ranged in age from 18 to 65. There was also a small loss to follow-up, with only 19 of the questionnaires not being able to be used. And another design strength was that the participants were randomized. A communication strength was the use of graphics in the comic flyer. Unlike the CDC flyer, it didn't just list the type of vaccines. They actually presented a scenario where a person came in and spoke with their doctor about vaccines. The timing of the study was also a strength, a communication strength. The study ran from December to January, which are peak times for flu and when people normally get flu vaccines. So this was a way to reach people when they may or may not be on the fence about getting the vaccine. And they also used a reliable instrument to evaluate whether their communication was effective. They wanted to test attitudes and intentions, and I think that was a strength. A study weakness was that the study only took place at one institution. It's hard to tell if it would be generalizable to other parts of the country because it was only done at that one location in Queens, New York. Also, there were more females enrolled in the study than males. Females, there were 191 participants, and males, there were only 74. That could also be a generalizability issue. As far as communication study weaknesses, there was no mention of pre-testing prior to implementation. They mentioned a previous study that was done on pharmacy students, but they didn't pre-test the message prior with audience members that they were looking for, which was just general public, adults 18 and over. Also, some of the wording could be difficult for those with low literacy, so some of the wording may need to be adjusted for readability for that audience. And finally, there was no segmentation. The same flyers were used for an age range of 18 to 65 plus. The message could be better and understood more if it was targeted and tailored to certain populations within the audience that they were looking for. And here is my reference.